my name is Courtney. I'm a student at Meridian Community College, and today I will be demonstrating the proper way to suction a trach. The first thing when I do when I enter the room is perform hand hygiene. Hi, my name is Courtney, and I'm here to suction your trach. Can you tell me your name and date of birth? At this time, I will compare the patient's verbal date of birth with the armband. If the patient is nonverbal, I will also compare with the MRN number. And if there's a loved one in the room, I can ask that loved one to identify the patient at that time. Once I've established who the patient is, I'm going to make sure they're sitting in an upright position, and then I'm going to start my assessment. I have a pulse ox on his fingers, that way we can see how the patient's saturations are. I am going to just observe the patients for retraction, work of breathing, anything like that. I'll get the vitals, and I will also listen. Okay. At this time, I can hear secretions, therefore we will suction the airway. Before I start, I want to test my equipment. I will grab my suction catheter. If it was a wall suction, it would be 120 to 150, but since we have a portable one, we want it to be 5 to 10. I'm going to turn it on. I'm going to occlude, and it is between 5 and 10. So now I'm going to set up my sterile field. The first thing I'm going to do is check my water, the expiration date, and check for cloudiness. I'm also going to loosen the top. I'm going to drape my patient. Okay, I'm going to perform hand hygiene. Place on my mask. Top, backside down. I'm going to open my catheter. And at this time, I'm going to just touch the borders. I'm going to take out my box. Careful not touching the inside. I'm going to put on my sterile gloves. Okay, and at this time, I'm going to lip my water. Open my gloves. And I'm going to go underneath and out. Sterile gloves are on. Okay, so the next thing I'm going to do is remove my suction catheter from the package. All of this is sterile at this time. I'm going to grab my suction catheter. Now this hand is dirty. I'm going to connect my two connectors, and I'm going to test my suction. Okay, so I have adequate suction. Now it's time for me to suction my patient. So I'm going to hyperoxygenate for 30 seconds. I'm sorry. I need to remove my oxygen device. And I would hyperoxygenate for 30 seconds. Take it off. All right, and at this time I am going to suction. Go down 5 to 10. I would already have my suction on at that time. I would go down until I meet resistance, or if the patient coughs, I will pull back 1/2 inch and I will suction. Okay. Reapply the O2 device. And at this time I would assess my patient's vitals. And we also would do another 5 to 10 breaths, or 3 to 5 breaths. And I will also reassess at this time. Okay. The airway sounds clear. I'm going to reapply my O2 device. Take off my gloves. Perform hand hygiene. I would put on clean gloves. I will clean my mitts. Okay. I would also make sure I check the patient's saturation. And all of this would be trash. And recheck the patient's saturations. I would listen to the lung sounds again, assess the color, assess for work of breathing, anything like that, and leave them in an upright position. All right, and that concludes my video. Hi, I'm Courtney. I'm a student at Meridian Community College, and I am making an amendment to my first tracheal suction video. I forgot to clean my catheter after I suctioned the patient, but now I am going to demonstrate how I would do that. I will still sterile and clean. I would clean my catheter. And then I would get rid of all of my trash. And that is how you clean the suction catheter after tracheal suctioning.